Welcome, everyone. So, thank you very much for joining us today. And I'm genuinely thrilled to see such incredible energy and engagement from the sports parent community. Your presence says everything about how seriously you take your child's journey. I'm your host, Siddharth from Prose Edu, and today we are back with Chapter 3, the Prose Playbook. And this one is very, very special. And about Prose Education Academy is an exclusive online school designed for the schooling needs of sporting kids from grade 6 to 12. Flexible learning, curated subjects, and valid certification is what we are known for. So before we dive in, I would like to take a moment to introduce the man whose vision brought this space to life. He built Prose Edu from the ground up, a school designed specifically for student athletes. He's a design thinker, someone who took the unconventional path himself and never looked back. Everything you see in this community, every session, every chapter, it starts with him. Mahesh Rao, thank you very much, sir, for creating this space for the parents and for believing that student athletes deserve something built just for them. So we are really grateful you're here. And now to our guest for today. It is my pleasure to introduce Dr. Amol Patil. Dr. Patil is India's leading sports physician, a professional who has worked at the highest level of sport with elite athletes and Olympic contenders. He now brings that expertise home, focusing on motion analysis driven care right here in India, helping young and professional athletes alike move better, perform better, and stay injury free. So today's session is titled From Understanding Injury Prevention to Achieving Peak Performance. And it couldn't be more relevant for every parent joining this room. Because here's the truth, without the right guidance, young athletes don't plateau. They risk injuries and setbacks that can follow them for years. As parents, we always want to help them, but we don't know how and why. That changes today. So Dr. Patil is going to help you understand movement efficiency, help you identify early injury risks in your child, and equip you with the tools to support their journey towards peak performance with both confidence and care. So Dr. Amol Patil, very warm welcome to you. And we'll start with your brief introduction and maybe on this topic, very crucial topic about the injury.
Thanks, Siddharth, for that kind introduction. And, I really thank the Pros Education team and Mahesh sir for inviting me here and basically creating this platform where parents and all of us can have a dialogue and, we can help each other to understand better about how to help our kids become next gen sports persons. So I believe that, every child who is stepping into the field, into that court, play arena, has a dream, and the
Right.
dream is to win,
Yeah.
to represent the country, to improvise, and to create something bigger out of it. And the hard truth is that talent is not enough. Hard work is also not the only thing to success. Because every year we have been seeing many talented young athletes who are forced to stop or take a pause in their career, not because they have failed, but because their bodies couldn't match up with the pace of training, of competing at elite levels, which the ecosystem is demanding today.
Right.
And injuries, as I said, can happen, will happen, burnouts can happen, the pain can force the athlete to stop, and these are not just bad luck. And I
Mm.
want to tell that to parents that, please don't consider these injuries, burnout, pain problems, etc., as the bad luck. They are result of wrong training, poor recovery, and maybe lack of awareness. Because if we can balance all these three segments, I think we can create a great environment conducive for the growth for that kid, and maybe they can remain injury free for a longer duration. But in the end, injuries is the reality. We push the children harder,
Right.
sometimes without knowing their limits.
Right.
And that's where I feel that parents should understand what are the limits, how to decide on those limits, how to assess that limits. And there we are for the discussion today. I'm sure Siddharth and we, will be talking a lot about
Yes.
these things. I'm not, just covering everything right now, but I believe that our focus should be on right technique, right execution, building strength, not just the skills, recovery, an important issue. And most important, we should teach our kid how to listen to the body, what it is demanding. Because if
Hmm.
we can rightly teach that kid to know that, or, understand his or her body, I think half of the work will be done and the rest of the thing can be supported. We as support team, we as support personnel will come in picture only when somebody will tell us, okay, I need that help.
Right.
And that is
Right.
only will happen when the child is able to tell us that, okay, something is wrong, I'm not feeling good.
Right.
And
Right.
that part has to be taught, and it's here I feel the parents should understand this reality and this truth. And that's why we are here for this discussion.
Absolutely.
I think without taking much time, I'll hand over to Siddharth for you
Yeah.
know uh, conducting the session further with setting this tone. I think we can move on.
Right. So I think that's very crucial what you have started. And let's start with the foundation. Let's start with the basics, which is like how and why do young athletes get injured? This is asked by several parents, and many of them are already here, and they want to understand that how do we avoid injuries? How do we help our kids play without getting hurt? So, any point on that?
So, first thing I would like to, tell you all is injuries is a part of your, you know, sporting journey. Why do they happen? They happen because of wrong techniques, wrong training techniques. Then the loading pattern, which is how much you're training, if that is wrong or not in proportion to recovery, then
Right.
injuries can happen. And then there are certain weaknesses, certain things, biomechanical errors. Some are inborn, some are acquired. So all these things together contribute to injuries in a larger perspective. So we need to understand what went wrong. So, when I approach a kid, or as sports physicians, we have been trained to look at kids, or even the athletes, in a different way, not like regular doctors or orthopedic surgeons. What we do different is we don't see what is the injury, we see how did it happen.
Mm.
We take more time in understanding how it happened on the field, what you felt, what you saw coming, what was your immediate experience when you experienced that injury for the first time.
Right.
Because that help us to understand the mechanism of injury, and once we are clear on the mechanism, we know what are the risk factors for that particular injury, and we can treat those risk factors. Because treating symptoms is not done. I mean, I don't believe in that. That if you have, let's say, ankle sprain, I just don't mean that you treat the ankle sprain for 3 weeks, you're giving exercise, you're giving rehabilitation, and it's done. No, it's not that. It will recur again, and I
Mm.
just don't want it to recur again. So I need to
Mm.
understand what happened in the first time, why the
Right.
time sprain happened. Was it a medial side or a lateral side? What is the sport? And is there any specific weakness for that athlete? So if that is being taken care, I think we can prevent it. So understanding mechanism of injury is important before we proceed on how to deal with that. And that's what makes sports physicians different in approach, I believe, and that's what is needed today.
Right. And I think on the similar lines, some parents want to ask or understand about the movement patterns and compensation. So which movement pattern should we watch, and how what are the red flags that we should look out for, so that things can be cured quickly, and the pay and the kids are playing again, athletes are back in the track again,
So
to the track.
my honest answer to this question would be, you should observe how a child is playing, and is there any variation?
Okay.
Is there a pain? Is he having pain related issue, or is that pain making him change his posture, his overall walking pattern, his running pattern, and all? Because that's what is easily identifiable, easily picked up by any person who is not trained to look at those things. The
Mm.
rest of the fine patterns and imbalances and all, those are really complex things. I think we should leave it to the experts to handle it. But red flags, as you rightly said, what I feel is the form of play, the easiness in the play, and if there is pain in while playing. These are, I think, some critical markers which any child can point out or any parent can look into, while the child observing the child, and they can just come up to the expert that, okay, something is wrong. Can you figure it out? Because that's where the experts can help them.
Right. And so one of the parents asked this interesting question, like, how do you differentiate between useful fatigue and harmful fatigue? And how do we know when to push and when to stop?
So for that, you need to understand the training and loading cycle.
Okay.
Now, to explain it very simply, I will say that you need to load the athlete, meaning you need to train the athlete and push him off his limits so that you're overreaching overreaching at certain point. And this overreaching is something which is in beneficial zone. Because
Right.
once you push him off the limits, the body tries to adjust to that overreaching phenomenon
Right.
and then it recovers.
Okay.
That's the normal response. But when this overreaching, over pushing, it is so much that body is not able to recover properly, then that brings the performance down. That's where the fatigue, which is there, which is harmful fatigue, which sets in, and that
Right.
disturbs the whole cycle. And we try to be into this the cycle of overtraining and overreaching responses. So I believe if you have a child who is playing normally, I mean, who's training over the week, um, let's say 4 sessions or 5 sessions a week and all, just observe whether the next day when he's getting up, is he fresh? Is he cheerful? Because children are curious, they're cheerful. They have their own way of expressing themselves. If there is any difference in that, try to understand it can be inadequate recovery. The first thing a parent or a mother can point out, because parents understand their kid much better than any other one. And even the coaches can also understand that part, that when they're coming in, just ask them, okay, how are you? Just casual. So you saw in movies that I forget the movie. How's the Josh?
Right.
That is just to check the readiness of an athlete before a session. That how you are prepared for the session. Are you
Right.
feeling okay? Are you 100% here? If you're not, please take a leave. Because if we push the athlete in this scenario where he is not mentally, physically committed, it will land into more injuries.
Right.
So that's the difference, I believe. The one where you can recover quickly from the fatigue that has been there, it's a beneficial fatigue. But where the fatigue is so much that you're not able to recover even after 1 day, 2 day, 3 days, and there
Hmm.
is soreness, there is a lot of pain, that's where you need to consider that you are into that harmful zone.
Right. And then there is a follow up there. Like, uh, sometimes, the kids are not able to tell their parents or their coaches the exact problem. So, how does a parent understand those signals? Because they are not communicating all the time.
Siddharth, I see most of the kids and parents struggling with this question. And the reason is not kids are not able to tell them. The kids are afraid of telling their parents because they believe the bond between them and the coach is so much. And
Hmm.
if I tell my parent and if he speaks to my coach, or if my mother speaks to the coach, I will lose on some, selection trial, or I will lose on something. So that thought is actually stopping them from telling the reality or
Hmm.
conveying the truth to their parents. And this is where I believe is a major gap, where I urge all the parents who are attending today that please talk to your kids. Please make the environment more conversational. Please, interact with your kid in such a way that they feel safe to tell you, and do not just go on, barging to the coach and telling him every day that this has happened, this has happened. You try to have a conversation with coach, your kid and yourself on same page, and try to be, once a week you can meet the coach and you can tell him that, sir, I feel that this is something which is happening. Do you think it's normal? Or do you
Hmm.
think we need to have some additional support for that kid? Because
Right.
that's where the conversations will bring open discussions. If you're just going to point out something, I think the coach will tell you, Tumko kya samajh mein aata hai? I mean, are you a coach? I am the coach. So that is
Right.
where the ego clashes happen, and most of the
Yeah.
problems are being overlooked. And this is not just in the grassroots level. We have seen this in the Olympic teams as well. I mean, I was with the elite teams, and there we saw these problems coming in, where our players used to hide injuries, and then you suddenly see in news that okay, so and so went to the
Mm,
Olympics and then came back with the injury. So it was already there. It was just concealed, just to
right,
secure that selection and then
right,
represent the country and all those. So it is a next level thing. I
right.
believe we should teach our kids to understand first thing. If you're fit, you can play. If you're not fit for playing that day, you should not push your body because your life is more important. The quality of life element has to be understood. And that's where I believe education will play a great role, where we can tell our kids that, okay, it doesn't matter that you have to win always. You have to
Absolutely.
always play or you have to always represent. You're doing your part.
Yeah,
Selection, whether yes or no, will not matter on, it doesn't decide who you are.
right.
And I think that's where parents play a great role.
Right, right. Mahesh, sir, do you have any particular point on this? I think this is very interesting. You must have come across this question quite a few times.
It's so nice to hear what you say, and it's so true. And I wish parents take you seriously and start contemplating. It's just not about the game. It's
Right.
about so many things that you spoke about. One of the things that uh, in India we're yet to be a sporting nation, and I believe that uh, there
Someday
are
we will.
multiple reasons. There are multiple reasons why we are not a sporting nation, but we from Prose Education believe that we are solving a particular problem. I mean, looking at, I'm not saying that is the only problem, but a problem, saying that in the quest of wanting to play professional sports, uh, you, you, the normal school, I'm not against everybody. It doesn't happen for everybody. People who want to spend more time in the sporting field um, find it difficult to go through a normal school because of a various reason. Maybe the timing, maybe the subject selection, uh, maybe the attendance, maybe a different reason because our education system is done by and large by the British for STEM. It is perfectly suited for STEM. Let's accept it. Otherwise, we would not have the Fortune 500
Mm,
CEOs from in India in America. Let's accept that. So there
right,
is. I'm not blaming. A lot of people blame the education system. I'm not here to say that. I say it is suited very well. It is suited very well for people who want to do STEM. My the question that is people who want to be in humanities or in sports. And it's not for everybody. For some people who manage both, they're very good. I will always recommend. But when you're not able to do well, they fall back on education. And in India, there's something which is very funny. In a class, when somebody is getting high in science, he gets compared. But an athlete is not compared to anybody else. If somebody is drawing very well, somebody is painting well, that talent is not compared. You don't get
right.
a credit system
Yeah,
for for humanities. That's the issue. You have credit system for everything. You have a number for physics, you have a number for maths, your number, but you don't have a number for having spent in the field. So in the quest of wanting to play professional sport, the normal,
yeah,
10th and 12th gets affected, and rightfully so. They have to finish their 10th and 12th. And in the compulsion to do 10th and 12th, most of them give up, the sporting career.
true.
So I understand the predicament of parents, and I'm of the opinion that a sport person is an intelligent human being. He needs education should revolve around his ability. I believe that if you're a sports person, if you're a potter, if you're a designer, education should be, science should be taught over that skill. The
Absolutely.
science, it's important to live with science. There is no life without science, correct? You have your talent and then you have the scientific achievement. Like doc, you are a doctor, you are a talented person, you are an athlete, you've played so much of sport, and now you enjoy doing that because you learned the science of that game along with the talent that you have. It's the icing of the cake. Every time you tell something, it it makes me feel so nice. I think that is what it's all about. And I think what we are trying to do is help people to achieve this. I'm only a platform. I can only do this much to help people to achieve this. Uh, Back to you, Tiwari. I Siddharth, and I will continue on more and more But here we have to listen to Dr. Amol and his
Yes.
inputs.
Absolutely. And we will take questions from the audience as well. At the end of this session, we will open this comment and you can put your questions there and we'll take it there. So thank you very much for your patience. Now, moving on to the very specific question, which is related to swimming, because a lot of parents are asking questions on the swimming, like what kind of injuries can happen in swimming. And one parent specifically asked, like, preventing shoulder injuries for a swimming whose main stroke is butterfly. And then another asked, how what is the preventive measures to minimize shoulder injuries specific to swimming? So, what is your take on that, doctor?
So I believe that in swimming, if I look into my clinical practice, I see majority of the students or the kids who are coming to me are having shoulder injuries particularly, and many of them also have shoulder along with the back injuries. So these are two common things that I see, and the third one is hamstring cramps, that hamstring problems I see. So these are, I think, the three major injuries that I see in swimmers.
Hmm.
Different strokes have different way of presentation, but I think these three are major ones. And coming back to your question, that what you can do with preventing this
Preventive,
shoulder
yeah.
injuries, I believe your warm up plays a great role, and this is not just for swimming; it's for any sport.
Yeah,
Warm up is the key to every preventing injuries. If you do the
absolutely.
right kind of warm up, which includes functional exercises specific for that sport, I think your half work is done in prevention. And how to do a warm up is a skill which, unfortunately, in our country, nobody teaches. So, our coaches will be very good at
Hmm.
telling you how to do a particular skill training, how to do a tactical training, how to do
Yeah,
understand the game scenarios and all those things.
right,
When it comes to warm up, they say, okay, you just do running and all those things for 5 minutes, 10 minutes, 15 minutes, until the time they enjoy the tea part. And that's usual scenario at, I practice in Dadar West and I see at Shivaji Park things happening. And I'm not saying that, I'm not blaming anybody, but that's what is a usual scenario.
right.
Now, I'll clarify all your,
Hmm.
myths and facts here that about warm up. A warm up is something which is almost 40 to 50% of your maximum intensity. So the intensity of warm up is already defined. It has to be 50% of your maximum, intensity. That is
Hmm.
VO2 max, what you call peak level of thing that you can achieve in your training session. You need to do the warm up at least 50% of that intensity. That's the number one thing. You
Oh,
should include all the functional movements which are going to be there in that particular sport. For example, if you're there in football, I suggest you do FIFA 11 plus, which is a set of 11 exercises, which is a beautiful combination of how a ball and yourself can be engaged in a warm-up activity, and the leg and ball coordination, and along with that the agility and all those things are being explored beautifully by FIFA. And it's been proven that if you do FIFA 11 plus in the warm up, you will not have major injuries in football. So similarly in swimming, if I talk in context to swimming, there is FINA shoulder program, FINA. So it was previously FINA. Now I think they changed the organization name, but the protocol still is available as a PDF in the, if you search Google, and you can see the functional exercises of all the shoulder things can be done very for any stroke, be it freestyle, be it butterfly, it doesn't matter. So if those are done properly, I think majority of the problems will be taken care.
absolutely.
And when it comes to the problems that we see, the back injuries and the shoulder injuries and the relation between two, these are again technique dependent. And most of the patients that come to clinic, I always tell the parents, bring the video of the kid when he's training, because I have to see what is happening. And
Right.
if I and trust me on that, we're not treating them. I'm just telling them to modify certain technique in their training part, and their entire problem, it disappears. And the parents are, next time when they come here, doc, this has disappeared. I say, yes, it's science, it's physics, it's movement efficiency. If you just improve your efficiency, the problem will not be there. So you
Absolutely.
just try to understand that, I know that I'm not a coach, I'm not an expert to tell them how to train or how to learn that coach, particular stroke. But I understand one thing, the basic buoyancy principle in the water, and how a person is going to propel in water, and how
Right.
efficiently he or she can propel in water. If you align with those principles, those are the key things
Mm,
anybody will teach you.
mm,
And if you are aligned with that, the injuries will not happen. It will be more efficient pattern.
absolutely. So I think you talked about warm up, and it is very crucial. And as you said, that if athletes are doing the warm up right correctly, and if coaches are telling them, of course, a lot of our coaches are not aware with the right warm ups. So that can prevent, of course, most of the injuries, and that can help athletes to perform better. But my another point is about stretching. A lot of times athletes forget to stretch, they don't know what's stretching. So can you tell us, or the parents here, how important is stretching for an athlete?
So, I have a different take on stretching, because I believe stretching is of two types, if you know, dynamic and static
Static,
ones.
yeah.
Static stretching will be more prone to injuries. Dynamic one is really helping you out. But I have a different take on stretching part, because I believe stretching is something which is, if you don't know the elastic limit of your muscle, you will
Mm,
injure yourself more. So, a stretch where partner is used should not be done, because
okay.
your partner does not know your uh, ability or your elastic limit of muscle.
Right. Right.
Now, second thing is, what is your elastic limit. So if you have a correct feedback and you can stop at right time,
Mm,
then dynamic stretching will really help you.
mm,
But it can be done as a part of cool down, not in terms of warm up, because warm up is something where you're preparing your body for that particular sport on that day. Stretching and all those things are something which are kind of a maintenance thing which you're doing after you have trained, so that you see that, okay, there's no tightness. There is, so after your active recovery is complete, after your cool down is there, now any niggles or any of these things which are remaining, any small knots in the muscle and all those things, there you need some kind of stretching and all, which will help you out. But evidence wise, if you talk today, if you say that, does do you have level 1 evidence on stretching, whether it is helpful in preventing
mm.
injuries? We do not have that one.
All right.
It's
That's
useful, I do
yeah.
not say you don't do it, but as far as evidence is talked about in scientific literature, we do not have level 1 evidence on that.
I think that's quite interesting because a lot of coaches and athletes are trained about stretching. So maybe a follow-up question from a parent here who is commenting: cramps are major issues in swimming. So hydration is in swimming is very important, and I think hydration is equally important in every other aspect. So do you have any particular insight on this?
So swimming has its own challenges. You're in water and you're dehydrating,
Mm,
and you have limited time to hydrate yourself, because every time you have to hydrate, you have to come out of water or get the bottle on the thing deck. If
mm,
there are 50 people in the same lane traveling, doing, it's hardly you can stop at the uh, in the changeover. So that's the first thing. And that's where it gets more complicated when you're training at a pool where things are limited, your lanes are limited, you have more kids there, and the breaks for hydration are very less. So that's where coach's strategy will help you to understand and get this thing better. Now, when it's hydration, you need to understand a swimmer will need two bottles to be carried, one for plain water and one is with the rehydrating solution, and that can be a simple lemonade.
right.
But we often do not carry two bottles. I have not seen kids
That's
carrying two
true.
bottles. I mean, this is something which is the basic which everyone should do, not for swimming, for any sport. That plain water and a rehydrating solution, because not always you will have that sugary syrup solution to to ingest, and it can create nauseating feel as well.
Right.
Whereas body requires huge amount of water, it depends on your sweat rate. So first you should understand how to calculate your sweat rate, and
Mm,
then you understand how much you need a replenishment. So there is a formula: 125% of your sweat loss is a rehydrating fuel you should have within first 30 minutes of your after you stop the training or a sport or whatever it is. So those are the formulas which you understand, but for that you need to understand how to calculate sweater. And this is
Right.
where I think you should ask your coach, coach, please help me understand how much is my requirement for today in terms of hydration.
Right.
And if you can match that level, I think these things will on. Specific to the cramp part, the cramp, as we understand today, is not just electrolyte imbalance. It
Mm.
is neuromuscular problem as well today. So not all the cramps that we see in swimming are related to electrolyte imbalances.
All right.
And many of these cramps are result of your inefficient muscle involvement.
Mm.
What happens is when you're training and when you're applying excessive force, your body has a preventive mechanism. When
Mm.
it when your muscle is eccentrically stretched, meaning it
Right.
is being stretched beyond its elastic limits, body senses that okay, this is something an abnormal movement, a tear
Mm.
can happen, I have to
Mm.
prevent it. So it sends a signal to the brain that okay, this is something which is abnormal happening, just contract it so that the things can be prevented. That's where the cramp sets in most of the time.
Right.
It
And
is when you're doing or over,
yeah.
kind of overperforming or maybe substituting a muscle which is not there for that action, kind of applying more force for doing a normal action or normal movement. So let's say you need 100 Newton force for that, you're applying 400 Newton force for doing the same movement. Here is not, here the movement becomes inefficient. You're
Right.
losing more energy. And that's where these kind of problems will come in. So when you have a tendency of cramping,
Right.
I suggest first go back to the first step, see your technique, whether it's correct. Second, check your training load, whether you're in the overtraining zone or not. If
Mm.
these two things are correct, then maybe you need to consult a doctor that okay, something is happening. I need to understand what else is the problem. But if these two things are not matching up, then you need to correct these two things first. So these two are preventable things at the coaching level itself. I mean, anybody can do it. You just need to understand why is being caused. Yes, Mahesh sir, I think you want to add something here.
No, no, something. No, no. I wanted to, especially, I can only ask about very interesting about tennis, and I always wanted to know. We all believe that as we go old, as we grow old, our muscles we become tired, and the youngsters have more energy. How did the top Federer, Djokovic, and Nadal face half their age champions and still played 5 sets? What's
See,
the technique of
body
body
has a
size?
immense potential to adapt. As you grow older, your understanding about your own body improves. So
Mm.
I believe they have more advantage about knowing their body's biofeedback. That's the key edge that they have. Yeah, youngsters do have an advantage in terms of the agility and the strength and all those things. But when it comes to the commitment and all, we have legendary examples where, many of the master athletes have outperformed the youngsters, and they're we are seeing more and more coming up in that space. The reason is if you have right amount of training and better recovery and nutrition, which is supportive to this training load. And then you have a right understanding about what you exactly want to do in that particular event or that particular match. Then I think everything can be balanced. It is a simple mathematics, I would say. If you know the equation, the results will come in.
Super,
Great.
super.
And
You just need to do that maths properly, and it's you have to do on paper. So I
right.
believe, and I tell everyone that winning strategy is mapped on paper. You need to understand that, and it is a science which is backed by all these things. So nothing is impossible. And in sports we always say everything is possible if you are committed and if you believe that it is possible. And this will only happen if you can map your own journey on paper and see what is the factor that can be corrected, what is the factor that can be improved, because there is always a scope of improvement even at the age of 100.
Right.
Wow.
Very well said. Very well said, doctor. And we will move to a tennis related question, but I think there is a very interesting question on the gymnast part from our one of our parents, Deepthi Reddy. How about back pain and injuries for 11-year-old gymnasts? So maybe there is a quick question on that.
So I'll just quickly answer this question. Gymnastic is about your flexibility and your agility. These two skills. That's why we start very early in gymnastic,
Right.
the training part. Now, what happened is the whole sport is based on one basic principle: balance.
Yeah.
Balance on ground, and that's where you balance your body in relation to the gravity.
Right.
Be it on bar, be it on the wall, be it anywhere in gymnastic, you are always balancing yourself.
Right.
That's the first thing. Now, when you use your back muscles more than required
Hmm. Hmm.
in balancing, that's where the back problems start coming in. I'll give you an example. Think yourself like a tent.
Hmm.
You have four knots which are balancing the thing, and there is one bamboo which is there inside, which is keeping the tent erect.
Hmm.
Now, just think that you just loosen the one end of that tent. What will happen? The tent will shift
The
to
load
one
bearing.
side.
Hmm.
If you want to stay erect and balance this tent, what you will do the first thing? You will try to pull the loose end more
Right.
and try to put more force on that loose end.
Right.
That's what your body does. When the other muscles, other factors are not performing to the level
Hmm.
of what they should be doing, the loose end gets pulled more to balance or counterbalance the fall. Basically, you're
Right.
falling because the gravity is constantly acting on you, and you're trying to balance yourself upright in relation to gravity. And it's here your the muscle which is weaker, it tries to pull more so that it can balance the other tensions.
Right.
Now, in
Right.
this model, what happens is the back muscles, by and large, are the ones who are bearing the brunt of all this balancing mechanism. And that's where most commonly these injuries happen in anyone, be it a 11-year-old gymnast or be it even younger to that, or be it even older to that. So problem is not in the gymnast. Problem is
Hmm.
again in the technique of execution.
Right.
Problem is again in the teaching of that particular action. Most of the things happen in vault basically, those
Absolutely.
flips. So many of those player gymnasts have these issues. And I think revisiting the training part will help you to solve many of the problems. We say that core training really helps and all those things, but these are what is therapeutic interventions. I believe in prevention. I do not believe in therapeutic things more, because this is where the injuries already happened, the
Hmm.
damage has already been done. I
Right.
believe you can prevent it before it can happen. So if you just understand what is the basic thing, you can play more focus on it, and things can be prevented before they actually led to those injuries. Because once that injury happens, the life of that athlete is not too much. And we have seen too much many examples of players who have been good gymnasts and they're not there today.
Right.
I mean, at 22 and 23, they stop representing the country.
Right. So I think that's very well taken, and I hope Deepthi got the answer. So now moving to tennis, one of the question which is quite interesting is about the wrist injury. So how can one prevent wrist injury and uh, play better?
See, again, I'll come to the, basic part, how you hold a racket.
Okay.
That decides a lot. And are you having the right grip? Meaning the size of grip, the girth of grip. Now, those
Right.
there is a formula. You have to calculate the distance between your index finger and the base of your hand, and that distance has to be, three-fourth of the circumference of the
Hmm.
racket. That's the usual thing for any racket sport. If that's not there, you have to change the grip, either increase it or decrease it. Now, these things have to be understood scientifically before you choose your first racket, because
Hmm.
once you choose your first racket and then you move on, you are kind of adapted to that equipment, and you never think that this is going to change. So you
Right.
fix the notion on one thing that, okay, this is not going to change. Now you try to adapt to that racket. Humans are living person. Racket is a dead thing. You don't adapt to the racket has to adapt to you.
Definitely.
Understand this part, because if this is not done, you will have problem.
Hmm. Very
One is a dead
interesting.
object, you are a living person. So
Absolutely.
compensations will happen in yourself if you are trying to adjust to that level. So here, in racket sports, this is the most common problem which we see. Many of the times, the wrist problems, the elbow issues, these all stem up, and the real issue is not in the wrist and elbow. It's about how you are holding that racket.
Right. Right. So now moving to one more interesting question. Actually, this is being asked by Melvin Pereira. He asks, like, is ankle support good for ankle rehabilitation, and can the same be used while practice and competition?
Ankle is the only joint which is in contact with the ground when you're standing on the ground. So
Right.
I believe it is the most dynamic joint which gives you that movement dynamicity.
Right.
If you're going to put a support to it, you are going
Right.
to restrict its degree of freedom.
Right.
So, in my opinion, support should not be worn when you're
Mm.
rehabilitating.
Okay.
But in our medical practice, we have different opinions from different doctors, and nothing has been concluded, whether we should use it or not. It's always we believe that symptomatically, okay, if you feel that it's good, you use it. That's what is the last sentence any doc is going to tell you, that okay, if you feel okay now, you use it. Same happens for the kneecap. Okay, doc, can I use the kneecap while playing? If you're comfortable now, use it, no problem. Because so what happens is you're trying to adjust to the
Yeah.
patient's ideology, and you're trying to match up because you
Yeah.
know that nothing worse is going to come up. But really, that is going to help you? No. If you're doing a rehab, the best part is you're doing proprioception training, meaning the ability to sense yourself in space, in the relationship between different joints. That's proprioception. And ankle rehabilitation, the first fundamental thing that we have to do is proprioception. You remember when we were kids, I mean, we're talking about our previous generation and our
Right.
generation to some extent. We used to do that langdi,
Hmm. Hmm. Hmm.
single
Hmm.
leg hopping.
Hmm.
That was the best ankle rehabilitation exercise because it involved proprioceptive training. And
Hmm.
I believe all of us have done that.
Yeah.
And today's kids have never done that. That's where ankle problems are more in today's kids. Today we have specializations of foot and ankle surgeon. Why? Because the floor has changed. We
Right.
were on the mud and sand and clay courts and everything. Now we have
Right.
floors everywhere. So the
Right.
surface has become more flat, more rigid.
Right.
Our we just imagine the design from where we evolved from ape like monkeys,
Right.
which were moving in jungles from one tree to other tree and all those things. So they had that arch in the foot so that they can support all these movements. Suddenly the floor has become concrete and flat, and
Yeah.
then you say, oh, my kid has a flat foot. It's acquired deformity. It's not something which is some problem that he's born with. It is an acquired evolutionary change which has happened. Now you need to tackle that part.
Right. Right. And so, very interesting. I mean, there's a follow-up question. So, what does a flat-footed kid do? Because a lot of time they are discouraged from playing
So
sport or physical.
in my practice, I always ask, do you have a pain and problem? If you do
Hmm.
not have a pain and problem, we do nothing,
Okay. Okay.
because we are not going to go against evolutionary changes which is happening.
True.
If you have pain and problem, we try to understand what is the risk factor that is causing pain and problem. We try to
Hmm.
resolve that part.
Right. Okay.
See, in evolution, you lost your tail from a monkey. Now you don't ask for tail. So same thing. The flat foot is kind of an acquired defect which is coming up, which is going to worsen further.
Hmm. Hmm.
But that's a change that is going to be there in small ways. It is
Hmm.
going to be there. Unless it is troubling you, so even you are adapting to that new way, no? That you are
Hmm.
adapting to these synthetic floors.
Right.
So unless it's troubling you, the pain is not there. Don't bother about it. Don't
Okay.
go into evaluation. And and one more thing I want to tell all the parents here: do not go for that, insoles and gimmicks that is there in the market. There is no ideal footwear in the market.
Hmm.
Do not spend your deep pockets on those marketing thing that this shoe and this footwear and this insole and this orthotic thing is good for my kid. No, your body is dynamic. Every time the pressure changes when you're moving on a floor, so your shoe which has a rigid insole solution will not be helping you in any way, whatever you may try. And the one that material really helps you is the EVA, custom EVA, but that's not done in India. In order to have that custom sole, you probably will need
Yeah,
to shell out nearly 2.5 to 3 lakh per shoe.
yeah,
And I believe that is not an investment anybody is going to look at. So
that's
all the things which are marketed in at present in terms of the shoes and insole supports for those flat fits and all, they are not the exact solutions that are there. Those solutions came in for diabetic footwear where the problems were different and now being extrapolated to sports and saying that, okay, this increases performance. No. Any shoe which gives you comfort, which has a good counter support, which has a good grip is good for you. Expensive shoes are good. That's the myth. So it's not like, I mean, yes, there are variations. You obviously want to have a better comfortable shoe and all. But if you can't afford a better one, and if you have a basic shoe which has a good counter support, it has a good grip, even that's sufficient for you. No need to buy a very expensive shoe for performance, because performance is not only dependent on these factors. That's what I want to tell every parent, that do not take your kids to buy a new shoe every season just because they are going to affect the performance. That's not the
absolutely
real predictor of performance, I would say.
great. I think that's very insightful and that's very helpful for a lot of parents. And now moving to the racket sport, we were talking about tennis. Now let's move on to the badminton. So there are questions like how do we prevent injuries in badminton, and what role do diet, conditioning, and strengthening play in uh, the player staying injury free in badminton?
So you want me to tell that what are the common injuries?
I think we can start with common injuries
So
first.
common injuries are the ones that is wrist and elbow, which is common. To some extent, shoulder and back will also contribute in badminton. And the knee injuries are again common ones
Yeah.
because it's played on a uh, court, and the court may differ at different places. Ideally, we need a wooden court, uh, the rosewood wooden court, and all those things. But anyways, I believe that the knee problems can be taken care if you are doing a good warm up and a kind of a prehab before the injury
Mm,
happens. So if you can do this patellar training exercises, I think most of the knee problems will not come in badminton.
okay.
And trust me, if you are able to do this, the other problems will also not surface, because uh, not just in badminton I'm talking, it's in all the sports that we can understand. All problems are related to kinetic chains. Now,
Mm,
that's where I specialize, and I believe that's what we do differently from other people. We identify a pattern and we identify the kinetic chain which is causing that pattern problems. So kinetic chain is meaning, let's say I have to lift this hand. So all the muscles which will be contracting in a sequence to get this hand up is my kinetic chain. So
mm,
every action has a kinetic chain. That's a brain's mapping, which is there, which has a, brain knows that what I have to do, and for that action, what sequence of events has to happen. That's
mm,
kinetic chain. Now, if you are in that kinetic chain, you understand that if you correct the things at proper level, let's say in the case of a badminton, I was talking that if you are able to strengthen your knee joint, the other joints that are higher up in that kinetic chain will not bear the ground reaction force which is coming abruptly on the knee that time, because
mm,
that knee has been strengthened. So the
mm.
force will diffuse at that joint. When it will not traverse through that kinetic chain higher upwards, even the other joint problems will not appear so suddenly as they are appearing in other places if
Right.
it's not done very well. So one corollary I think from here that all of us can take up is, if you have right amount of conditioning and strength training, you will you will prevent injuries in almost
Mm,
every part of your body, because of those kinetic chains. And you can remain injury free for a longer time. So that's one, I think, takeaway message we can have it today.
Right. I think that's great. And now, quickly on the other part, which is we haven't talked about too much, which is diet and conditioning. I mean, conditioning and strengthening, of course, but diet part. So, what should someone do for the diet?
Do not have any fussy diets plans. Your Indian diet, traditional Indian diet, is sufficient to take care of all your energy requirements and your protein requirements. It's
That's
just that
good.
you have to understand that remain traditional, remain uh, as much as possible, avoid those processed foods.
Hmm.
Whatever is packed and has expiry date should
Right.
not be consumed.
Okay. So that includes milk as well.
So don't take literally and
Yeah. I
figuratively
mean,
there. But
that's true.
the
That's true.
idea is as much as possible, no processed food, no packaged
Hmm.
foods,
No,
because they all contain preservatives and they're not natural sources. All everything which is available to you, raw natural sources,
Hmm.
do consume that. Just remember one formula for protein intake, and I think every parent can understand here. You know your weight of your child, so just when they are in puberty ages, let's say around 8 to 10 years onwards and all, you just calculate 1.5 gram per kg per day. That's
Hmm.
your protein requirement. 1.5 gram per kg per day. Now that's once you know the protein requirement from the whole day. Now from all sources that you can, the entire day, divide those protein into different meals and then
Meals. Yeah.
constitute your entire protein requirement. You do not need supplements for that. A normal Indian diet can give you equal amount of protein. A vegetarian diet can give you the same amount of protein. So all the things that are being presented by many of influencers and the miscommunications happening on social media and all, please do not follow it. Understand our ancestors were much brilliant than us. They have devised those traditional menus for a reason. And it is that we are going away from those traditional menus and we are kind
Hmm.
of making a fusion thing today, and we are having those more processed food. That's why we are having this problem of lifestyle and all those things. Just
Right.
go back to your roots and you will have the problem being solved.
And I think Mahesh sir will really, he really like this answer, I
I
think.
like that. Good answer. You know, it's so interesting to see you talking about thing. And the only point that I want to tell parents is one is, of course, there are athletes as a kid, and I want all parents to believe that in their life as an athlete, there is a. I always believe that 25 alphabets after A. A can be your playing career, your B, C, whatever. Z can be your career, right? You have multiple careers that you can do once your sporting career is over. And in that, um, we are the belief that it is no longer sports or education. We are in the journey saying that sports is education. It is education, and that's what that we are building. And that will happen because the moment you're schooled, like how I see such brilliant way of thinking, is you get into a sort of um, analytics, which is just not about descriptive or rather diagnostic or predictive. In my opinion, it can be even prescriptive, which is what the new age is, right? I mean, it is like somebody asked me an example of how you can give a prescriptive way of knowledge, and I travel to America very often, and there is a lot of parents who go to America, and the kid is playing the basketball, which is not a part of our game, because to play basketball you need to be at least 6 feet. The least of your height should be 6 feet, correct? Below that, you can't get into the basketball, and everybody is much taller than that. And I realized that parents are 5 feet at an average, but the kid is 6 feet. So I said, where is the prescription? He's saying that the basketball outside the house is the prescription. They play every day in the morning. So genetically, you're out of that zone, that just because parents are 5 feet, you know, there is a way in which you can say that they can be 6 feet. That's one way of looking. And the other way I want people to be educated and knowledge is, I think the only example I'm sure you would have heard uh, this is that even in, I don't know when, I think if I'm not mistaken, when Germany lost their football match World Cup, I think in 2002, and they went through the whole uh, research as to find out, and this prescriptive method of saying that they did whole analysis to believe whatever tactical change, blah 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 blah, and the suggestion given is that the sporting academy should be aligned with a school.
Hmm.
Unless and until we don't have schooled children, analytics won't come in place. Okay. And it's important that the analytics happen in the playground rather than the the coach standing outside the ground and trying to shout inside the playground. The point I'm trying to tell parents is it's no longer sports or education. I want kids to do well in sports. I want them to do well in education wherever they study. And the more they get educated, they will do better in sports. They'll perform with better understanding, and whatever you are saying will be easily understood and applied. So that is all I can uh, I request the parents and believe that this is a possible thing. Back to
I'll just
you, Siddharth.
just
We are
I'll
here to
add
hear
one
you.
thing. I'll add
Yeah,
one
go
more
ahead.
thing here that even our government's vision is changing now. We now have understood that schools are the nursery for next Olympians, and there is a change in
That's
PMO's vision for sports
true.
from this
Lovely,
time
lovely. Hope we all together, all together, we all together achieve that objective. So
onwards.
we are
More,
glad to listen to you.
one more thing I want to highlight here is do not blame your genes because genes
True.
are just the blueprints.
Correct.
The actual thing may vary. So your expression of those genes vary based on your environment. And if you have a conducive environment for growth, for sports, for competition, for anything, I think you can adapt to that and you can improve yourself. So I most many a times I see that coaches and parents blaming, oh, we are Indians, we are having poor genes, we do not have that strength gene and this gene and those testing which is happening. So in market right now what is happening is sports gene testing is also coming up and the nutrigenomics is also there and so on and so forth. So there are a lot of investigation based things coming up in the market. I just want to ask you one single question: is sports a trainable ability? Yes, it is trainable. That's why you have coaches. If it was
Yes.
not a trainable quality and it was genetically dependent, you don't need a coaches system and coaching system. Yeah. So
True, true, true.
your whole existence of coaches and the system is that it is a trainable ability. And if it's a
True.
trainable ability, then it can be trained to any level.
Right.
Correct.
Absolutely.
Perfect. Absolutely.
100%, 100% agreed with that thought, doctor. And now let's talk about the other aspect of sports, which is very crucial, which is recovery science, right? And as most Indians want things fast and quick, so what one of the parents has asked, like, what is the fastest method for the recovery of any athlete?
Good recovery, you should have good sleep, more than 8 hours of sleep. The
All right.
fastest and the best and the free treatment that you can
Yeah.
have. And the second one is nutrition.
Right.
So your recovery nutrition has to be planned. It has to have the right amount of carbs and proteins that can take care of the recovery part because you just calculate the amount of training load.
Hmm.
Based on that, you just calculate what is the calorie deficit created
Hmm.
and just try to replenish that with the bare minimum which is required for the basal activity. So again, I'm coming back. It is a mathematics. You just plan on paper. Just
Hmm.
take a paper and see how much kilocalorie of activity you have done today, how much kilocalorie you need for basal maintenance. Just add to that and just complete the deficit.
Right. And then there are new terms I'm sure you might have seen about the cold therapy and hot therapy and ice bath recovery. So how effective is that? And a lot of kids or parents are influenced by that. So
Yeah. See, a a dal chapati in Michelin restaurant and a dhaba, does it have a difference in nutrition? So same is that, you have a sophisticated way of delivering a cool,
Yeah.
cryotherapy and all those things, but you have same thing can be done by ice bag.
Hmm.
If I have the deep pockets, if I have that,
Hmm.
facility, I'll use a cryotherapy.
Hmm.
Easy to deliver, less problem for me.
Right.
But if I don't have that, I'll just pick an ice bag and get the recovery done. I mean, inflammation can be settled with ice bag. So all this fussiness over recovery modalities is, um, I believe we should not focus on that part. It it just depends on how best we can afford it.
Hmm.
But it
Right.
is not a priority. Instead, invest into something which is more critical, more important. Um, Instead of investing in all this cryo and all those chambers and this compression garments and all those things, I believe you can do one good investment is your heart rate monitor, because that
Hmm.
tells you analytics for your recovery, that tells you analytics for your load, training
Hmm.
load, and that helps you to understand your body's biofeedback.
Right.
And I am not seeing athletes wearing heart rate monitors and training. Such a shame, because
Yeah.
nobody's aware about it.
Right.
And this is not talking about grassroots athletes and state champions and all. I have not seen people understanding the data derived from heart rate monitors, even in the people who are actually training for Olympic games.
Right.
Even they are ignorant. Even the coaches at that level are not ready to accept the thing. I mean, fortunately, in last 10 years, the scenario is different now. We have been forcing to include all those variables and all, and now, thankfully, the the system has accepted it, and we are moving in the forward direction. But still, there is a huge chunk of space where variables are not being used,
Right.
and you don't have data. A simple thing, how much load you did, what is your HRV, heart rate variability, that gives you a prediction about how good is your recovery, how you are prepared for today's session, and what is the effect of today's session. Just
Right.
plot it on an Excel sheet and you can plan the graphs. You don't need a analyst to tell you that what it is there. A basic Excel, anybody can handle it.
Right. Right. I think that's very interesting because data helps us get better. And I think there is a follow up question as well, which we'll quickly take after this topic, which is about the mental side of the game, right? So, how does a parent or how does a kid go through that phase mentally and recover from it? Because I believe, I mean, that's my personal opinion, that if you are mentally fit, you are happy, I think your injury becomes, I mean, you can recover quickly. So, but in most cases,
Siddharth,
when, yeah.
I believe that this mental issue is an important one,
Hmm.
but unnecessarily we are making it complicated. The
Hmm.
first thing I want to urge is you have to have a clear communication with the kid.
Okay.
Problems start when communication is not there.
Hmm.
So once you have a good communication, your kid, yourself, and the coach, I think half of the problems can be resolved. When you ask me the other side, that when you have an injury and you have a mental, breakdown or a depression kind of thing about how to recover and all those things, I believe that if you have this communication sequence in place, the child will not feel left out, or he will not have the negative effects of what he is experiencing, because he's been constantly counseled for, or maybe the conversation is so normal that he's not feeling that he's injured. It is only when you point out that, okay, you're injured, you're sitting at the bench, he will have that feeling of, okay, you missed out, the FOMO kind of thing. And it can be overcome by simple things. You just keep the conversation on. The second thing that you can do is imagery. It's a
Hmm.
powerful tool. You
Hmm.
imagine that you're
Hmm.
playing when you're
Hmm.
injured, especially when the ligament injuries happen, when you're doing a surgical intervention and you're on the bed for
Hmm.
2 weeks, you're not getting up from the bed, and that's mandatory recovery. You
Hmm.
start imagining yourself that you are actually playing or training, and that gives you a powerful visual stimulus. And
Hmm.
that stimulus is itself like training, because
Yeah.
You don't, your muscles are trained for that thing. So once they have a visual cue, they
Hmm.
will have that memory of muscle which will be activated. So you will not lose on your performance also. That's how elite footballers, I'm talking
Yeah.
about EPL, English Premier League footballers, or La Liga footballers, coming in same season after the injury. Season
Right.
is very small, and they have an injury, they have a comeback within 8 weeks of that injury, and this is only possible because they have this strong mental attitude of visualizing, of
Yeah.
of self-talking, prepping up, and all those things, which is there in their system, and that's bringing them fast from return to play.
Right. But I think, doctor, there must be a limit of visualization. Sometimes visualization can be harsh for
You know,
the athletes,
I
and
always tell my I, I can tell you one example from my
yeah.
past. We had a gymnast guy, and I was just in the stadium, and that injury happened in front of me. He
Hmm.
was doing a vault, and he collapsed, and he landed on his neck. He has a quadriplegia. The Both the hands and both the legs power lost, and a very promising career person, and coming from a very humble background. We did the initial part, shifted him to a spine injury center, and the operation was done and everything was done. But then, will he come back? Because the power in all four limbs lost.
Hmm.
He cannot live. That's a vegetative life that he has. That was a bigger question. And I was just telling him, see, boss, if you want to come back, you have to see that you can do the things normally. You just
Hmm.
start visualizing. Today, that boy is again playing gymnastic.
Wow. Wow.
So
That.
it's not, I have done something different. It's not that he has done something different. It's just one basic principle he followed. His recorded videos, his and the best performances in gymnastic in his event, he just saw those on mobile phone. I mean, and the father was really helpful to him when he couldn't get up from his own thing. I mean, his hands and legs were not having any power. His father used to show him the screen and those videos and everything that motivated, and you know so background was 4G. Naturally, that
Hmm.
helped.
Yeah.
But what I'm trying to tell you is imagery is so powerful. If you do it right way, you
Yeah.
have a potential of getting up from a almost dead like person. And this is something which I have seen with my eyes. So I don't I believe it more strongly now. Earlier we were taught in textbooks, we were taught in medical colleges, these things are possible, the neuro rehab is possible, and so on. But today, I believe that this is one case which, and this is not the only case that I have seen. I have seen multiple things which are having similar uh, scenarios where imagery has worked to the excellence level,
Thank you
and that
very much, doctor, for sharing this
and
story.
today
Yeah.
we have the technology which is coming in VR space, where you have
Yeah.
VR headgears, where you can imagine much more immersive and
Hmm.
experience that you can give it to the person who is recovering from an injury. Just imagine a person that he's on his bed after a surgery, and you're giving him a VR headset, and you're saying that, okay, now you're playing on a football ground. He has the entire ground in front of him. You
Hmm.
can just customize his ground photos, put in that VR headset, and now he's playing in his own ground tomorrow, next day, after the next day of surgery. Just imagine if this is happening, he will return to play much earlier than what he used to.
Hmm. Of
We
course.
have that technology at our advantage nowadays. It is becoming, at least we can have now access to this kind of technology. I don't say it is affordable at the moment, but yes, it will be affordable in next 5 years.
Of course. Of course. And I think very well said. And thank you very much for this sharing this story. Everyone, I think, loved it. Now let's get to the questions. I think there are a lot of questions, and slowly we wrap up in 15 minutes. So let's start taking question. I think there is one question from Narendra Nikam. He asked, in MCL, ligament strengthening, uh, how can we do, or like how can we strengthen that part?
Hey, you have to pay me consultation. any ligament, be it MCL, LCL, or, ACL or PCL, anything. The first thing is to balance the tension, the normal joint,
Right.
understand mechanics of a joint and balance it. So we first balance the joint. So the first step that we often do is we try to understand what is the limitation of that person. Then we try to give him certain corrective exercises where we focus more on strengthening the other ligaments with respect to the weaker ligaments so that the force can be redistributed.
Hmm.
Once done, we try to integrate the proprioceptive element, and then we try to build the whole strength of that person. So that's
Right.
step by step process, 3 to 4 steps which are being done, and eventually that person is able to carry out his thing. So you
I,
will see that a person who has grade 3 tier of
hmm.
ACL, anterior cruciate ligament, most commonly injured one,
Hmm.
with a structural defect without operation, he can return to play within
Okay.
8 to 10 weeks.
Great. Great.
This is the power of rehab. And we have hundreds of stories of successful comebacks. So it's not that it is not possible.
Hmm.
Your commitment and your dedication and your compliance will ultimately affect the return to play things. Yes, in some cases things get messy and you need surgeries in those parts, but those
Hmm.
are very rare ones. Not
Hmm.
everyone has to follow that routine, and that's why I'm a strong advocate of exercise is medicine. We believe exercise can do wonders if done properly, and
Right.
prescription exercises really help you to get what you want.
Of course. So now moving on to the next question, there is a question how from Amod Rahatkar. He asks, how do we identify threshold between physical stress that can lead to injury versus acceptable stress due to progressive overload from training?
I told my in my previous talk as well.
Yeah,
You need to have a heart rate monitor. Just follow the
yeah,
graph.
okay.
Plot the
That's
HRV, that heart rate variability. And today you have the wearable
hmm,
softwares which can be installed on phone, and you can get easily reports. You don't need even to calculate those things on Excel sheet. You just have
hmm,
the report and you just observe the graph whether the recovery and load is matching up. If you're having that understanding, I think your most of the part is done. Whatever is recovery is possible, that's acceptable load. If it's not possible, then it's something which is not acceptable range.
all
You are
right.
going into over training zone.
Okay. And I think same Amod is also asking a question like how to prevent injury for a 11-year-old fast bowler in cricket. So we have talked about all the sports, and finally we are talking about cricket.
Uh, be it cricket or any sport, again, the prevention will start from first step, that is your right kind of warm up, good technique, efficient movements for that technique,
Right.
and then followed by a good cool down, which is often missed in majority of the. So um, I'm seeing many cricketers, and I ask one single question to everyone: what is the warm up that you do, and what is the cool down that you do? And
Right.
90% cases, 95% of the times I hear we do not have a structured cool down program, and warm up is something that we do before we
Hmm.
are playing, but then they have to practice in the nets. So by the
Right.
time their turn comes in the net, they're already cooled, and they don't do again warm up,
Right.
and that's where the injuries happen. And a common observation that I'm telling you, and this is cricket we are talking about. In Mumbai, we are
Yeah.
very sentimental for cricket. So, a lot of cricket around us. And the biggest sport, I would say, for India at the
Yeah.
moment where we are doing fairly good, which has a structured program across the country like no other sport has it.
Right.
Still, the basics are being ignored. That's what I want to highlight here. What
Hmm.
parents need to understand is that it is the culture that we need to bring in. The
Hmm.
culture where warm up is given a preference, the cool down
Right.
is maintained. All these things become a part of your training journey. Once
Right.
this is put in place, we will have our performances. Because our
Right.
system is lacking this, you know, right way of doing things, we are we are seeing more problems today and injuries to see.
Right. And I think, Doctor, this is very commonly asked and noticed thing from the parents, because they mention that strength and resistance training is overlooked or is not paid too much attention in Indian coaching. So, and they also want to know, like, if a coach is not telling these basics, right? So how can they, master these ability, or at least have the basics, so that they can, tell it to their kids?
I look this problem often in my practice, and the way I do it, I'll tell you. We need to understand first whether we need strength training or resistance training. Do we really need it?
Hmm.
Second thing, we need to understand what is our problem at the moment and which phase of training we are,
Hmm.
because that will help us to understand what and then the final goal where we are supposed to move in. Because if we have understanding of all these three things, then we can better guide that person whether to go for a training or not, or when to include, what to include, how much to be
Right.
done. So that understanding will be there. Now, first, without your balance, coordination, and agility, you cannot directly start on your strength training part. So
Right.
unless you have these three abilities trained to an efficient level, you cannot go on the directly jump onto the strength training part.
Hmm. Hmm.
A common mistake which many people do in the gyms, one fine day, usually 1st January of any of the year, you go to the gym, register, and you just go on lifting weights. And 15th January, you're done with the gym. That
Pay.
happens because that happens because you never paid attention to the first three elements and you directly jump onto the resistance training part because you saw others talking about it, you saw others happening around it. That's why we are just following, and that's what is herd thing, which is there in the market at the moment. So an individual consult is really required, whether the person needs a conditioning or not, whether
Right.
he needs a strength training or not, whether he needs both or not, and let the experts decide what is good for him or her.
Right.
So I always suggest, go to a SNC expert and tell him your problem and get a solution from him.
Hmm.
Don't
Hmm.
try to search on Google, Gemini, and ChatGPT and create programs.
Of course. Now, there's one more question, which is around stamina and building it naturally. So, one of the parents asked how to build stamina natural, and this is very common question throughout the nation.
So, stamina, I take it as an endurance part, meaning you're training the ability of endurance.
Yep.
Now, if you want to train for endurance, we need to understand what endurance you need to train. Are you training for a particular sport or in general? Because in general, if you're training, you're training for a cardiovascular endurance, you can go for a slow jog and running and all those things, 30-40 minute of thing that is going to give you that basic thing. If you're particular sport that is involved, then you need to understand whether it's a power dominant sport, it's a speed
Hmm.
dominant sport, or it's
Hmm.
it's both, or aggression is more
Right.
combat.
Right.
And based on that, it will be either a speed endurance training or a power and endurance combination. So when you understand the requirement of sport, you can actually train that particular endurance or stamina for a particular thing. Let's say interval training or circuit training. Those all are modalities which can be put in place once you understand what is the requirement of the person.
Right.
So a generalized prescription cannot be done for anyone
Yeah.
as to what kind of training has to be done for endurance or improving stamina. And it is again, it is a relative thing. So one day you feel that you are good, second day you may not feel that you are good, and the difference between two states is recovery.
Hmm.
When you have an adequate sleep, rest, and good nutrition and overnight sleep and all, the next day you feel okay, you are more energetic.
Right.
The next day you may not have the same thing. That doesn't mean your endurance level has fallen down.
Hmm.
So again, it's a relative term and it
Right.
has to be trained often. Yes, it plays a great role, but then let the experts decide in this case.
Hmm. Absolutely. And now, one of a critical question, and it might be a very common asked question to you is, a lot of parents are vegetarian, right? So how do they meal prep for their kids, or what should be the best food choices for their
See,
kids?
you just need to balance the protein requirement.
Right,
1.5 grams per day per kg per day.
right. And
Tell your
in
kid, tell your kid that you have to consume this much amount of protein every day. The rest you can eat whatever you want. I tell the same thing in my clinic to anyone who comes to me. You want to eat pizza? Yes, eat pizza after you have done the 1.5 gram per kg per day intake.
right.
And believe me, eating that much is not easy. So by the time you finish your protein requirement, you don't feel like eating a pizza.
Right. And I think there is another question in it, which is like, what should they eat in terms of the protein? Because in vegetarian, there are very limited choices, as they say. So, any
So
suggestions?
you have soya beans, you
Yeah.
have paneer,
Yeah.
and tofu. So I believe, I mean, tofu is better than paneer because paneer has equal amount of fat as well. So a lean protein, I mean, if you just intend to have more protein, tofu is a better choice. Soya bean is a great choice.
Hmm.
Then you have all your dairy products. Vegetarians, you have your sprouts and all nuts and soaked nuts and all those things. So ragi, and so there
Yeah.
are n number of sources that you have in vegetarians. And if you balance, see, I feel you have all the dals in your house. Mix
Hmm.
those dals,
Hmm.
create chilas out of it. It's a good source of protein.
Okay.
Almost 10 to 12 grams of protein is done there. So
Right.
good breakfast with besan chila or mixed chila, moong chila and all. It's a
Right.
good source of protein.
Right.
Come back to the afternoon, you have a vegetable dal again, having some servings, and then either paneer or soya or any combination. You will meet up the requirement. I mean, it's difficult, but it's not that difficult that you cannot have that protein intake to be completed. A glass of milk will also help you to get some protein.
Right.
So, I mean, you have to balance. I suggest you buy a make some investment into kitchen scale that comes around 300 or 400 bucks. It will help you to estimate how many grams of things you're eating. You have NINCA guidelines, National Institute of Nutrition, Hyderabad,
Right.
that helps you to understand one spoon of this, one katori of dal, and one katori, 1 tablespoon, one teaspoon, and all those measurements are given in that. You can calculate based on the appendix that is there. So all the values can be calculated, and you have everything with you. If you don't
Right.
want to do that much, download free apps, and you can have the basic calculation
The
done,
food, true.
and it's easy for you. A measuring scale in kitchen is really required these days.
Couldn't agree.
Very not oftenly seen in the Indian kitchen, but that really can help you to
Absolutely.
balance your requirements.
Absolutely, I couldn't agree more.
All right. So I think as we are now going to close this session, any final thoughts, maybe Mahesh sir or Doctor, you want to sum it up, and before we wrap up?
I think we have spoken a lot
Yeah.
on various uh, things, but
Right.
I feel one important thing: recovery is really important in performance.
Hmm.
So always support your kid for that recovery part, and do not compromise on it. So if your child has not recovered, do not send him for training, because I often see, and this is my observation in clinical practice, that you know parents sometimes become too much competitive instead of their kids,
Hmm.
and it is
Hmm.
the competition between the parents which the child is child is in pressure, because he see his father and mother in competition with the other parents who are their work colleagues or something like that. And that's where the things get more messier, I would say, for the child because he's not able to understand and adapt
Right.
and what to say and when to say. So I see a lot of 10 years and 11 years struggling in this segment. So that competition has to be eliminated. The
Right.
third thing I feel is when you see that either your child's sleep is disturbed,
Hmm.
or his studies is affected, or his recovery is somewhat affected, his just see how happy your child is.
Hmm.
If he's playing sport, he has to be happy. If that
Right.
happiness is lost, if that plastic mask face is coming up, then there is something which is grossly wrong.
Hmm.
Go to the diagnostics and just see what is wrong, because you see 12-year-old kids, and I often see them, they come to the clinic and they say, okay sir, I have this thing, that blah, 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 blah. So much plastic face, their
Yeah.
bubbly, their entire curiousness and everything is lost.
Right.
They are in state of pressure, I need to perform, and I'm here to extract maximum from the doctor, that okay, what I can do for doing best. You are here to enjoy.
Yeah.
I don't say that you are competing at 12-year-old age, because our long-term development model does not tell you that you have a specialization at 12-year-old thing.
Right.
We choose our specialization in sport after 15 years of age.
True. Yeah.
Why to compete before that? I mean, all this thing is stupidity, according to me. And people don't take me very well for that, but I believe that quality of life is really important. You
Right.
have to live 80, 90 years along with it. So in first 10 years, if you try to overachieve, and rest of the years, if you fear the problems
Yeah.
with what you have seen. So you see a lot of athletes having, back problem, knee problem and all after they leave this thing. What is the use of living with that agony entire years of your coming life? It doesn't make a sense to me. Even
Absolutely.
if you're an Olympic medalist, it doesn't make a sense to me. And this is
Absolutely.
my personal opinion. Since this is a open platform, I will not say too much. But
No,
I
no, no.
believe quality of
It's
life is more important for me rather than an
Absolutely.
Olympic medal.
Absolutely. And Mahesh, sir, you wanted to say
so
something?
nice, so nice. I really appreciate. I think what you've actually strengthened our whole journey of sports is education, because here the parents need to know that here is an athlete who played well, and now he's bringing back. I've told this story a million times. I'm not a professional sport, but I play tennis and I play golf. I swim, I do paragliding, and I gym. I'm at a club level. But I still remember when we all learned tennis. We learned from the Marcus, with due respect to him, and we learned some game. But that guy made me run from one end to the other, and I can run. But we have never learned the skill of the game, so I can run, but you don't know what to do after that. Whereas that is how it was taught. And 5 years back, I went to uh, a professional coach who taught me golf only because he believed that golf has amazing sports injury, especially with your spinal cord, correct? And at 60, it's extremely difficult. So he taught me what I should do and what I should not do based on my body mechanics. The point I'm trying to drive here is it's so important that the kids who study in Prose Playbook
Right.
uh, have a great future, that they
Yeah.
finish their schooling, they can actually get deep into the subject and choose career that are beyond one could imagine a few years back. And that is what we call professionalism. And that's how you bring professionalism back into sport. And I can see it very clearly from the way you have expressed in your field. So I'm so happy to share this on the screen with you, Doc. So nice of you. I appreciate it. All the best to all the parents. And I need everybody to look at saying that sports is education, and you need to get in depth,
Absolutely.
depth knowledge rather than just frivolous knowledge. And I think
I
that's
think
all my take is.
thank you very much, Mahesh sir, for sharing that. And to sum it up, doctor said that quality of life is crucial rather than being a Olympic medalist, and I think that sum it up. So thank you very much, Doctor, for sharing your insights, your key information to the parents. On behalf of the parent, I thank you, sincerely thank you. And this has been really extraordinary session. And to each of you who are part of this session, thank you very much for joining. There is a feedback form. Please fill it. It won't take more than 30 seconds. So please fill it. It is really crucial for Prose Edu as an organization to grow and understand you better and come up with better questions and sessions like these. So Thanks, everyone, and wish you a very pleasant evening. Thank you very much.
Thank you very much. Thank you, everyone.
Thank
Have a
you.
nice day. Bye bye.